ladies and gentlemen, the U.S. healthcare system is at the point of collapse. So many doctors and nurses and all kinds of people that are specialized in the medical field are leaving so rapidly, they actually fear a collapse. And you know what? This is America's fault, ladies and gentlemen, for not doing right by these folks. If you remember in the very beginning, they didn't even know what to do for patients when they came in. And it's because, I don't believe these folks are stupid, but America never planned for a pandemic. America never trained their doctors and nurses in pandemics at all. So making the assumption everything was just going to roll along and nothing was going to happen. And that's the path they chose as far as training these folks. And like I told y'all in the beginning, there's not one hospital in America that is specialized in pandemics. And then, if you remember, they were begging all over the country for PPE. It was like weeks and weeks and weeks went by. And these doctors and nurses were, every time you saw them on TV, they were begging for PPE. And some are doing it right now, which means there has been no lessons learned from the first wave. So it's been tough on them. I was listening to, and I showed some of the videos of the nurses saying they can't even get a break. They are so overwhelmed. They're working through breaks. They barely get a time to eat lunch, and they're just caring for all these patients nonstop that need help. And it's been very difficult. And yes, this is going to impact their lives because every day they're going to be on edge to whether they catch this. And we know some doctors and nurses have died from COVID. They fear bringing it home to their families. They got children. It's been a tough thing for them. It's been real tough. So this came out on Newsweek, ladies and gentlemen, November 28th, 2020. Top physician says U.S. healthcare system at point of potential collapse. Medical analyst Lena Wen warned on Friday that the U.S. healthcare system is facing collapse as COVID-19 hospitalizations went past 90,000. Wen, a former president of Planned Parenthood and visiting professor at the Milken Institute School of Public Health at George Washington University, told CNN, Jim Acosta, that people needed to work to flatten the curve. We're facing explosive spread in this country, Jim Wen said. We are on track to potentially reaching 20 million coronavirus cases by the end of January. And y'all, in November alone, there were 4 million new coronavirus cases in the US. So, and I'm so worried everything that is happening over Thanksgiving because we have a massive surge on top of another massive surge. So I would urge everyone who is still with their loved ones now, try to do your best to not gather indoors. Really, just know much. Our healthcare system is under strain right now. We are at the point of potential collapse of our healthcare system. Each of us need to do our part and stay away from these very high risk settings like indoor gatherings where people are constantly together. Wen went on to explain that there was a lag time involved in finding out how many people became infected over the Thanksgiving holiday, with a delay in those affected being diagnosed. People who are getting infected right now were probably going to be detected with infections in about 2 weeks. So she says, all of these people, millions that traveled all over the country to be with their families on Thanksgiving, she said in about 2 weeks, you're going to see the fallout from that. I think it's going to be sooner. I really do. All right. And she said, and we're going to see hospitalizations, ICU visits from that in the next 2 weeks. My advice to everyone again, do your part, not to gather right now, but if you already traveled and you are returning back to your community, know that you are at high risk, because not just the high risk of the actual travel, but because you gathered with other people and so quarantine for at least 7 days and then get tested. If you don't have any access to testing, quarantine for 14 days. Our healthcare system cannot withstand it. So we need to do our part. She's just repeating herself over and over. There have been almost 265,000 deaths from COVID-19 in the United States since the start of the pandemic, and 13 million confirmed cases of the disease. The Center for Disease Control and Prevention advised people not to travel for Thanksgiving, but we know they did. We know they did. So all you can do is deal with it. You can't undo what was done. Let me see. I think here's her interview. Let me see if I can play this.
We're facing explosive spread in this country, Jim, and we are on track to potentially reaching 20 million coronavirus cases by end of January. And I am so worried about everything that's happening over Thanksgiving, because we have a massive surge on top of another massive surge. And so I would just urge everyone who is still with their loved ones now, try to do your best to not gather indoors. Really just know how much our healthcare system is under strain right now. We are at a point of potential collapse of our healthcare system, and each of us need to do our part. And so stay away from these very high-risk settings, like indoor settings where people are gathered together. And how long will... Okay. We're facing explosive spread in this country.
So you heard that. It's just repeating. But yeah, so everybody be careful out here, because one thing about COVID, it seems to be getting a lot stronger as the weather is getting colder. Although we know this is a year-round virus, and I had someone come on to one of my videos yesterday and said, we are going to bounce back from this. We bounce back from the Spanish flu and yada, yada, yada. Well, this is not the Spanish flu. And America has already surpassed the Spanish flu with COVID. So I know, as much as you want to make this the same, this virus alone is not the same. I mean, the Spanish flu, one thing about that, because I read up on it, it dissipated when spring and summer came. That's why initially they believed that this was going to go away in the spring and summer. Then it didn't happen. So now we know this thing is continuous. It goes on and on and on, and it doesn't matter what time of the year it is. Number two, yes, the Spanish flu eventually did dissipate in 2 years, but that doesn't mean COVID is going to do the same thing. So, you're taking guesses, just like many of these experts did in the beginning when COVID came around. They thought it was going to be just like the Spanish flu. And lo and behold, it's different. It's definitely something different. So I wouldn't bank on 2 years and we'll be out of this whole thing. I mean, if you want to walk around and believe that, you have the right to believe whatever you want. But there are big differences as far as what coronavirus is and what the Spanish flu was. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.